Dexur is an AI-driven unified software for quality, safety, risk, and incident management. Organizations face higher costs by purchasing each type of software separately, ending up with 2 to 10 times more costs from all these different solutions. Such fragmentation leads to redundant data entry and disconnected processes among quality, risk, clinical, and performance teams.
Dexur consolidates multiple functions into a single platform, eliminating manual, repetitive work, enhancing quality, and mitigating risk, enabling organizations to save 50 to 90% on software costs. Dexur's data ingestion process integrates Dexur-sourced Medicare claims, hospital-provided claims, NHSN data, HCAHPS data, chart-abstracted measures, and other hospital-supplied data. Dexur helps to improve healthcare organizations by targeting key areas such as cross-program integration, encompassing CMS star rating, Leapfrog, VBP, HAC-RP, and other private payer programs such as Anthem QHIP. The focus is on optimizing specific program metrics, ensuring domain-specific and measure-specific improvements, and managing individual events or encounters to improve overall healthcare outcomes and operational efficiency.
Dexur works with healthcare organizations across the spectrum and is an endorsed partner of the Indiana Hospital Association, Texas Hospital Association, and the Hospital Association of Southern California.
Let's dive into the Dexur Quality module, where we will go through the module at the quality program level, measure level, and event level. Upon logging into the dashboard for your specific hospital, you will be directed to the AI Advisor Report section, which is an AI-driven report for all major quality program, alerts, and other measure-specific insights. You will be able to see the monthly and other periodic reports on CMS star rating, Leapfrog, VBP guidance, HAI, HAC-RP reports, and other reports. When you click on the CMS star rating, you will have an AI-generated summary of what is driving the CMS star rating compared to the previous year. You can see your current year's predicted star rating compared to the prior year's star rating. You can compare overall hospital group summary scores, and also evaluate domain-specific group scores, such as mortality, readmission, safety, HCAHPS, and timely and effective care. You can see if your CMS star rating is likely to have increased or decreased and what is driving it. For example, we can see that the summary score has decreased marginally in this particular case. The mortality and readmission group scores have improved, but the safety group scores have deteriorated significantly. You can also see what measures within the group have increased or decreased to impact the domain score and, ultimately, the final hospital summary score. For example, in mortality, measures that declined the most are COPD and pneumonia 30-day mortality rate, and the measures that improved the most are CABG, AMI, and heart failure 30-day mortality rate. Dexur generates this report monthly, offering hospitals proactive guidance on future CMS star rating performance. Additionally, we forecast performance on mortality, readmission, safety, and patient experience 1 to 3 years ahead. Dexur's annual predictions for the CMS star rating achieved an accuracy rate of 98% in prior years. Therefore, instead of leaving you in suspense about future outcomes, we offer a forward-looking perspective, highlighting areas where your performance may improve or decline. As you can see here, with Dexur's claims data and hospital-supplied data, we can make predictions almost 3 years in advance from the current period, indicating areas likely to improve or worsen. Our system automatically indicates the remaining time period left to impact the measure. For instance, standing today, you may find that only 11% of the time remains to impact the star rating measure 2 years from now. You will also notice the color-coded cells for each measure. The measures in the report are color-coded according to 5 benchmark percentiles, ranging from 90th, 70th, 50th, 30th, and 10th percentile. These benchmark indicators are also applied to forecasted data, which help you predict whether your performance is on an upward or downward trend relative to these benchmarks. As you scroll down, you will realize there are more than 45 different CMS star rating measures, and Dexur monitors, benchmarks, and tracks them all. Now that we have reviewed an example quality program report, let's dig deeper and go into the specific measure. You can click on any measure or report to the specific measure. Here, you can view a comprehensive COPD 30-day readmission rate report. By clicking the COPD readmissions, you will land on a detailed measure page. In this report, you can fine-tune your analysis with the data view and data class features. By selecting your data view, such as a rolling 3 years or CMS star rating, you can focus on the specific performance that matters most. And with the data class option, like Dexur Observed Rate or Dexur Risk-Adjusted Rates, you can dive deeper, comparing observed outcomes against risk-adjusted benchmarks for a well-rounded understanding. Navigating this chart might seem complex, but our AI software simplifies the process by automatically alerting you based on trends. For example, the AI will alert you if COPD readmission rates increase from 17% to 23% over a given period. Moving from the top 90th percentile to the bottom 10th percentile. The report also shows the programs impacted by these changes, such as CMS star rating, HRRP, IQR, US News, and Why Not the Best. Once an alert is generated, our software goes a step further by indicating what is required to return to the top 90th percentile. For instance, reducing 2 readmissions annually can elevate your hospital's ranking back to the top 90th percentile, prompting immediate action at the front line. Using advanced AI algorithms, our platform will automatically identify the top risk factors for specific readmissions, such as COPD readmissions. For example, if 18% of COPD patients at a hospital also have a history of COVID-19, with a 30-day readmission rate of 35% compared to the national average of 23%, focusing on COPD patients with a history of COVID becomes crucial for improvement. This capability allows for more nuanced and targeted interventions. Dexur also provides access to best practices collected from reputable sources, such as PubMed and other publicly available platforms. This additional layer of information empowers hospitals to implement proven strategies for enhancing patient care and outcomes. Setting goals for specific measures is a crucial feature that empowers healthcare organizations to take a targeted approach to improving patient outcomes and tracking hospital performance. Healthcare organizations can set and manage goals with parameters such as description, start and end periods, priority, and active status. This alignment ensures that teams are focused and coordinated in their efforts to achieve improvements. Another game-changing feature is that Dexur can help track the impact of interventions on specific measures. Hospitals always make changes in care, but there is no data-driven way to check if the interventions are working. With Dexur, you can load the interventions and monitor the impact of these interventions on the specific measures. For example, if you put an intervention related to 3-day post-discharge check-in, you can see the impact of the intervention on the measure. Similarly, you can choose events from the drop-down and submit them to monitor the impact of these interventions. You can also monitor your inputted goals to see if the performance of the measure is above or below the goals. Now that we have reviewed a measure, let's go even deeper into a specific event. We can return to the CMS star rating report and review a particular measure and its events. Take COPD, for example. Dexur's platform allows you to identify the specific 31 infections impacting a specific year's CMS star rating, providing unprecedented specificity. This level of detail is transformative, as individual cases, infections, or encounters were previously unclear in their effects on your score. With Dexur, the process is simplified. A simple click reveals the precise events affecting your CMS star rating, VBP, Leapfrog, and other quality programs. Dexur's platform goes further by pinpointing the specific bacteria or pathogens responsible for each event, directly linking to their impact on your star rating. Dexur provides potential root cause analysis and recommends corrective and preventive action plans. Dexur offers a complete workflow from predictive analytics to top-tier program management, down to specific groups and individual cases. This proactive approach helps healthcare providers understand and address issues, improving safety and quality scores. Now, let's go back to the AI Advisor and quickly go through some of the other quality program reports. In the Leapfrog Monthly Guidance, we monitor all relevant Leapfrog measures and provide guidance on spring and fall ratings. Each measure is benchmarked to different percentiles, and then the guidance is provided for the future. The report is categorized into two key areas: structural measures and outcome-based measures. This is as per Leapfrog's rating methodology, and under each section, the relevant measures, such as CPOE, falls, CLABSI, and CAUTI, are highlighted here. These metrics are crucial indicators of a hospital's quality of care and patient safety. Dexur's VBP Monthly Guidance Report is vital for hospitals, as it focuses on improving care quality and financial results. The report provides a VBP summary, including total performance scores and future projections, which are crucial for understanding the hospital's strengths, risks, and opportunities. The domain-specific measures give a more granular look at specific areas of care and service, with arrows denoting trends and changes over time. It further delves into various domains, including clinical, safety, HCAHPS, and MSPB. This insight enables hospitals to identify trends, target areas for improvement, and plan effectively for future success. Let's discuss our monthly HAI and HAC-RP report. You'll get a detailed breakdown of the measures influencing your safety group score. Here is Dexur's monthly HCAHPS report. This report presents a detailed overview of the hospital's performance across various patient experience measures. In this section, the AI software automatically highlights the measures that have improved or declined. Key measures include communication with nurses, communication with doctors, responsiveness of hospital staff, cleanliness, and quietness of the hospital environment. Upon reviewing individual measures like communication with nurses, one will find the involvement of various programs such as VBP, CMS star rating, and Leapfrog in the analysis, along with their respective time periods. Dexur remains committed to monitoring these metrics, providing hospitals with the insights needed to uphold exceptional standards of patient care. CMS Program Summary displays a year-over-year financial analysis for a hospital. The table combines the financial impacts, penalties, and adjustment factors for the VBP, HRRP, and HAC-RP, outlining their collective fiscal influences on the hospital. This summary allows hospitals to evaluate the financial outcomes of these CMS programs and understand their effects on the hospital's financial performance over time. Stay ahead with Dexur's readmissions and mortality quarterly reports. You can access a comprehensive report that provides detailed data on the mortality and readmission rates of different measures for a specific hospital. Here, you can find the readmission and mortality actuals and forecast summary, track all measures in detail, and forecast individual measure performance and associated risk factors and best practices. For your convenience, you can download the complete report in PDF format. As you can see, there are hundreds of measures across CMS star rating, Leapfrog, Anthem, and various private payer programs and initiatives. Managing these can be overwhelming for a single quality improvement department. To address this challenge, Dexur has developed an AI-generated early warning alert system. Our early warning consolidated report automatically identifies and highlights deteriorating measures, providing immediate insights into potential areas of concern. Let's consider a scenario where the report indicates that heart failure readmissions and pneumonia are worsening in a particular hospital. The AI automatically alerts you to these deteriorations. Here, you can view a comprehensive heart failure 30-day readmission rate report. By clicking the heart failure readmissions, you will land on a detailed measure page, which we have covered previously. Now that we have gone through the challenges and opportunities of monitoring so many quality programs and measures, how does one make a plan to improve their program performance? Dexur has manual and AI simulations to help you understand where to improve your program scores. First, the manual simulators can be used to help build intuition on where to improve scores. For example, changing Measure A, Measure B, and Measure C can help increase the star rating. Recognizing that a manual simulator will require a lot of work to choose from hundreds of millions of combinations and picking the optimal path. We provide advanced AI simulations to provide the optimal path to achieving a CMS 5-star rating, improving Leapfrog scores, avoiding HRRP penalties, and maximizing VBP payouts. These simulations allow hospitals to explore various scenarios and outcomes. Dexur's AI simulator runs through all the possible combinations of changes in all measures to come up with the scenarios to move to a higher percentile group and eventually improve star rating. These scenarios are then analyzed to find the shortest path to improve the hospital's star rating. In this way, Dexur's AI simulator saves hospitals the task of crunching through hundreds of millions of combinations to find a suitable scenario. Here's an example of how Dexur's AI simulator uses artificial intelligence to create simulations and enhance CMS star ratings. Dexur's AI-driven simulations provide foresight into healthcare by offering AI-powered simulations for quality programs. Dexur's AI simulator does cross-program simulations, showing which common measures in CMS star rating and other programs such as Leapfrog can lead to the best outcomes. The simulator analyzes all possible combinations of measure changes to identify the shortest path to improving a hospital's star rating, Leapfrog, and other programs, saving hospitals the effort of manually exploring numerous scenarios. Here's a sample hospital with a CMS star rating of 3. Dexur's AI simulator can provide insights into the shortest way to elevate this rating to 5. Dexur's AI-driven simulation can then be exported and presented in a simple format to help with the goal-setting process. Dexur's quality module ends the struggle for hospital teams. No more surprises with scores or how to improve them. Dexur's healthcare automation software builds on the quality module to integrate all quality, safety, risk, incident management, and other processes. Some of the modules available on Dexur's healthcare automation software include incident forms, chart abstraction, safety huddles, accreditation management, goals, peer reviews, and much more. The software is so powerful and extensible that we are working on continuously adding new use cases and processes to the platform. Now, let's dive deeper into one module in the healthcare automation platform. We will now cover Dexur's incident, risk, and safety module, where we believe quality and risks are two sides of the same coin. The better the quality, the lower the risk. Dexur's analysis of standard incident management forms shows that more than 2/3 of forms have a quality impact, and 1/3 have CMS star rating and other quality program impact. Therefore, Dexur unifies quality and incident management in one software. Dexur's incident management system comes out of the box with relevant quality, safety, and other events, including healthcare IT, employee grievances, facilities, and other events. When you go to the incident management module of Dexur, you will see a standard set of forms that a hospital can completely configure or modify and delete at your convenience. There are two views to the software. One is when an end user or an employee submits the form, and the other is for an administrator or investigator to review the form. Let's take the example of how an end user would submit a fall incident form. In the end user patient falls form, users can submit relevant information, like patient details, admission information, admission physicians, and fall incident details. Hospitals can integrate patient data to minimize data entry for end users. By clicking on the relevant incident report, the administrator and investigator can access and review the incident. Once the form is submitted, the relevant department, associated people, and administrator receive a notification that an incident has been submitted or an existing record has been edited. The user can click through to see the relevant incident, or go to the incident reports to see the relevant incident. In Dexur's incident management system, administrators can effortlessly scroll through filed incident reports and review the details. With a simple click on the edit button, they can update relevant information, including adjusting the severity level of the event using the drop-down menu. The platform provides a pre-generated list of assessments and medical care, immediate responses, and root causes, allowing easy selection of the applicable one for the specific fall incident. Incidents can be automatically or manually tagged to pertinent quality measures and programs, such as star rating, Leapfrog, in-hospital fracture, or other relevant quality programs. Moreover, incidents can be mapped to relevant corrective and preventive action plans. It's important to note that all forms are customizable. For instance, if a hospital wishes to add a section for policy violation related to an incident, this can be seamlessly integrated. Users have the flexibility to edit any part of the form and add comments as needed. Once the form is completed, users can return to the list view to process the remaining incidents. Dexur offers a wide range of reporting, listing, and sorting features. For instance, you can easily drag and drop records in the list view to rearrange them in any desired order. Filtering specific records is also an option, allowing you to focus on the information that matters most. Additionally, you can sort records based on any field you choose and save the current view for later use. In the saved view settings, users have the option to either share the filtered view with associated users or set it to private. When you need to share or analyze your data further, you can export the list and reports in various formats to suit your needs. Dexur's Incident Management module offers a high level of customization for forms, fields, skip logic, and other details. For example, in the IQRCEP section, the skip logic will enable or disable specific fields based on the requirements set by measure algorithms, which can save a lot of time for the administrator. The Advanced Permissions feature ensures that only specific user groups or departments can access, create, read, modify, or delete certain form sections. Additionally, the module supports nuanced workflows and statuses, allowing for precise tracking of incidents across users, groups, and stages. With this overview of Dexur's platform, we invite you to reach out to Dexur to learn more about how Dexur can elevate your organization.